don't need it. You don't need it. You don't need it. You don't need this. I do. You're good.
The Truth with Gwen Azama-Edwards, every Thursday at 6:15 on Goliath Radio. Gwen Azama-Edwards, retired city clerk, former city commissioner, City of Daytona Beach. The Truth with Gwen Azama-Edwards on Goliath Radio.
Stan, you've been sitting much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, you got it, power. And as always, I want to empower you to take control of your life, those things that truly impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access that all-powerful information via the all-powerful links. Oh, www.gwen-truth.com. We do know this is a holiday. It's a Jewish New Year. So we want to just say happy holiday and happy New Year, okay? I don't consider this as work. I consider it as something that I do and give it back. And my guests who are here, I'm sure, feel the same way. This is our opportunity of sharing with all of you information that will help make your lives better. And tonight we're going to talk about healthcare. I recall someone making the statement, which is so very, very true. If you did not have good health, then anything else you have really is devalued as a result of that. So good health is important. And we're going to talk about the Affordable Care Act. We're going to talk about progress thus far. We're going to talk about some upcoming timelines you need to be aware of, and other issues that are related to that you as our listener, as someone that we care about, someone that we want to make sure has the best information possible so that you can truly be empowered to take control, okay, on your life as regards your family's life and in terms of the community. So we're going to share that information with you tonight, and I would hope that that you would have an open mind to hear what it is that my guests are sharing with you tonight. Again, Happy New Year, and this is a Jewish New Year starting tonight. I can't, if I could pronounce it, I would. Rosh Hashanah. I'm sorry, say it again.
Rosh Hashanah.
Okay, Rosh Hashanah. Okay, wonderful. Yes, remember. Close to the mic. Okay, Happy New Year again. My guests tonight are very, very good friends of mine. We've been friends for years and years and years and years, but they're also, in my opinion and in the opinion of so many, knowledgeable individuals, some of the most knowledgeable individuals that you will talk to concerning healthcare issues and concerning Affordable Care Act. And that's Dee Schaeffer, who is with Halifax Health, and I always add Medical Center, but I think it's just Halifax Health now. And Linda Merrell, who is a child advocate, and she's with Florida Chain, and she'll explain a little bit what that is about. But again, they are two of the most knowledgeable people that you'll find on the subject of healthcare and on the subject of what's going on now in terms of the healthcare industry. And as we get close to the time of the opportunity for open enrollment, again with the Affordable Care Act, and it's the Patient Protection Affordable Care Act, okay? We want to make you aware of that timeline and others that are coming up as well. And so I'm gonna do my best not to say very much. I know I always promise that, and you guys always say, yeah, right.
Don't disappoint us, Gwen.
But, what can I say? I do want to give them an opportunity to share this important information, again, that's going to be important to you guys, to your family members, to your neighbors, your friends, and if you got any enemies out there too, I always say that it's good and important for everybody to be healthy because we're all breathing the same air. We're occupying some of the same places and spaces. So it's important that the person whose air you're also taking in and the places where they're sitting and you're sitting and all this kind of stuff that again, they're as healthy as possible because it contributes to your health or the decline of your health in many cases. So let me just go ahead and get started, and I'm not sure who wants to start off in the beginning, but you guys just go for it.
Okay, well, perhaps a good place to start would be to just review a few of the things that are in place currently with the Affordable Care Act. The Marketplace Exchange run by the federal government is up and running. We had a very successful open enrollment last year. We have nearly right around 900,000 Floridians that have signed up. And
Wow.
actually, Florida signed up more people on its federally run exchange than any other in the country. But some of the benefits that people are reaping already are that seniors on Medicare are seeing greater assistance with their prescription coverage when they hit the donut hole for having high prescription costs. There are certain preventive services that are offered that there are no co-pays or deductibles for, so people are actually being more proactive about getting tests and going in for physicals on a regular basis. Children can now remain on their parents' policy until they're 26 years old. People cannot be denied coverage for a pre-existing condition. Lifetime and annual limits have been removed, and a number of other things. But there are many things already in place that people are benefiting from greatly.
And these are people who, whether or not they're a part of they've signed up for the Affordable Care Act or otherwise, they're still benefiting from the Affordable Care Act.
Correct.
Right?
Absolutely.
From the exchanges, whether they sign up for any of those, they're still benefiting from these positive changes that have come about as a result of the Patient Protection Affordable Care Act, or better known as Obamacare.
That's correct, because all of those things that I just mentioned apply to everyone who has health care coverage, not just those who are enrolled in one of the exchanges.
Right. Which is, and I stress this too to our listeners, the exchanges and that part of it is one of the pieces of the Patient Protection Affordable Care Act. There's so much good stuff in that everyone is realizing and there's so much even better stuff to come as we move through with each year. I hear so many people say, it's been in place since such and such and such a time, and this is all that's happened in terms of how many people have signed up. But it started working right away, and it's just helped so many people, whether they're young or they're old.
Yeah, and two other, I think, very important points that are already in place are that a person cannot be denied. I don't know if I mentioned denied for a pre-existing condition, and an insurance company they just can't cancel you for, they call it rescinding coverage, and that is no longer applicable. And another significant thing, which many Floridians already received on average of 65 refund per family enrolled in the program, insurers are now required to spend between 80 and 85% of their premium dollar on health care coverage, and their failure to do so results in a refund to consumers.
Robust one to pay that too.
Very
I
much.
think last year or something is really, really considerable. I think one of the things to this community did, and that was an eloquent recap of some of the things that have gone on that are most significant, and it's still evolving. I mean, it's an active process. It's being refined as we go along. This community's been really strong in foster care, areas that are concerns. Now foster care kids can stay on, and they are now getting coverage up to age 26. Just like when Dee mentioned, those families that they can keep their young people on their coverage, on their insurance coverage. Well, actually, somebody that worked for Congress, who was a foster care son, said, what's wrong with us? Let's get on there too. So they added that piece on, sort of the last part of it. But I think what's really important for us to consider is that this is something that is going on, and it's in a good process, and it's in a good place, and it's being effective. And I think there's so many really good things.
And I want to stress that as you're talking too, because we hear a lot of pundits and a lot of misinformation, accurate information about the fact that Obamacare, I just call it that, or Affordable Care Act is not working. When statistically and every other possible way, it is working. It is working.
It's working, and it's being refined. And I think one of the other things for
as is true of any law.
Course.
Yes, as you get into it, you do make changes, and that's important to make changes and adjustments as you go along.
This may be a time to kind of define that we've got two definitive things happening under the Affordable Care Act. Before the Affordable Care Act, there was the Child Health Insurance Program that we in our community have a big part of, because we had the model here for Healthy Kids, which was the forerunner to getting the state child health insurance program passed in Congress. So when we're talking, it's sort of melding together now, because CHIP, which was pre-ACA, now has many of the components that are part of the Affordable Care Act. And the Affordable Care Act has given us and enhanced many of the child health care areas that were not getting full coverage that they needed. So it's sort of morphing, if you will, into these two different things. For instance, one of the things that we've had problems with forever with kid care in the administrative thing is the multiple doors that the families have to enroll in to get their child in coverage, and the churning that goes on. Well, I can proudly say that there's a no wrong door. One of the stipulations is to have a single application and a single point of entry for families. And I cautiously, with optimism, it appears that we have been able to accomplish that after a lot of hard work by not just the advocates, but by the agencies working together on this. So we have the no wrong door that we've been talking about for several years prior to the Affordable Care Act. And as you see this evolution of these programs coming together, it gives us the opportunity to be able to make some changes that are a long time in coming. One of the other things that, of course, you hit on the enrollment. I think we sort of came in first place in the nation. We came in first slot, and that was amazing when you think about the political dynamics, and not to necessarily be critical, but against all odds with a state that was not going to be able to participate and has done an awful lot because of their particular position. We came in first over some of the most difficult states, and I give that credit to young Nick Duran, is head of our Enroll Florida, Enroll America, and he did a superb job. So I guess with your words, man, he's a shout out for.
Yes.
I think I'm going to use your verbiage on that, but we really have come a long way, and so Dee, I don't know whether you wanted to add anything to that, but I think that the foster care program is really special.
That was a tremendous accomplishment, and those poor kids lose enough as soon as they turn 18 to begin with. So this was a step right in the right direction. But we have, as Linda said, we enrolled nearly 1 million people in Florida during the exchange, the initial exchange opening, and that is a tremendous accomplishment. We have another opportunity coming up November 15th through February 15th. It's the next open enrollment, and the Department of Insurance recently announced that this current year, this last open enrollment, we had 11 providers of insurance that were in the marketplace, offering multiple plans.
Right, right.
But 11 actual companies. And this next year, we are going to have 14. So
That's
the
a big
increased
jump.
competition hopefully will help keep the premium prices down. We are seeing on average increases in projected rates of about 13% for the coming enrollment period, some as low as 5%.
Mm-hmm.
And there is a provision in the Affordable Care Act that requires states to review premium rates to make sure that they're not excessive. However, last year, the legislature took that authority away from the Department of Insurance. So there's no oversight of any Florida rates in the exchanges. In the exchanges.
Actually.
So not until 2016 will the state start, unless something happens this coming legislative session, to reinstate the Department of Insurance's authority to negotiate premium rates. Basically what they said is that the federal government is running our exchange, so it's their job. But the federal government does not have the authority to negotiate rates with providers. So.
And for those who have the fear about their insurance and exchanges going up, there are a couple of caveats. One of the things you mentioned was that they have to spend at least 80 to 85% of the monies toward those who are their enrollees, and there's also, I was told, a cap on just how much they can go up. But you're saying for Florida, that just doesn't apply though. Okay,
correct.
so thank your
Regrettably.
legislators, Floridians, for removing the cap to allow and ensure that your rates wouldn't be going up, which is the problem that we had, which is kind of what caused and caused some of what they were trying to do and attempting to do through the Affordable Care Act. Even with that, one of the things you were telling me too on yesterday, Dee, was that they're telling people that if they are part of and they've signed up for an exchange, that before they automatically renew, that they should kind of
Shop around.
Yeah.
Absolutely,
Yeah.
because if their plan is one that is increasing 13%, let's say, maybe they want to take a look at one that is only increasing 5%, but again, there are navigators in place that are available to help people, and any questions, our office actually, we are not navigators, we are certified application assistance counselors, but if you want to give us a call at 323-0000, our staff will be happy to help you with the process.
And the other thing is that, because people were real concerned about making sure that they had the same doctors or whatever, in some cases they weren't able to do that, but they've now had a year of being with certain doctors. They might want to check, as they're checking, to make sure that those newer doctors or whoever doctors they have are also a part of the plan, the new plan that they end up deciding they're going to go to.
Exactly. They should check the network to see if their physician, if they want to keep their physician, is in that particular network, and what hospitals may be in a network, what specialists.
Right. The League of Women Voters, which is, as you mentioned, they're very, very involved with what's going on with the healthcare issue, and they've got some coalition of partners who are part of that, as with Florida Chain. But they did kind of a study in looking at the one in Tampa, and what they found was that the major reason that most people did not sign up for one of the marketplaces was because they felt they could not afford it. And what the statistics showed that better than 90% of the people who actually did sign up were able to get subsidies.
That's
Right.
correct.
Yeah, and I think that's a good time to plug the Enroll America website for any of your listeners. They have got a plethora of wonderful, wonderful information and connections, and I just saw one today.
They do.
On pushing for that enrollment November 15th, and they've got all sorts of tools. In fact, they have a very good toolkit they put out for first-time folks coming in, and it's so easy to access that and shop around and get comfortable with that, and to that point, I think it's important, I think it was just 2 days ago or last week that, the HHS announced the awards for the continuation of the enrollment. And our University of Florida Covering Kids and Families got that over 500 million, yeah, what is 500, yeah, $5,386,925 to be exact. That's a pretty good chunk, and it's up from last year. They did an extraordinary job with the navigators and training, as your hospitals have done. But the Northeast Health Planning Council, I think Joyce Case was here last time.
Yes, yes.
And we were talking about the navigators and the concerns and anxiety about whether or not there was gonna be trespassing of people's, personal information, which never happened. Because the model is sort of like what we did with enrolling kids into kid care. It was the same thing, and it's just expanded to a larger population. And I think that Florida, again, has kudos for the work that they did with that, and deservingly, got an increase in their amount for outreach again this year.
And one of the
So
major,
go Florida.
and one of the major reasons they said for those areas that were successful were those who did the outreach.
Correct.
Who really went into the places where they felt there were people who needed to have access to health care, and brought on some partners to help them in being able to not only reach the people, because the information is there, but also to at least convince them to have an open mind and to apply. Dee and I sat at the table at a recent luncheon, where there was a lady by us who said that there was an individual who was a neighbor who had applied for the Affordable Care Act, and he had such a bad experience that he went back and told everyone he knew, and ended up poisoning the well pretty much, from people who probably would not have had his experience and would have been able to apply with no issues, but as a result of what he shared, they were turned off by it. So what you're saying about Enroll America, that it's so easy for people to go on and just check it out for themselves. And you can do that without ever going ahead and signing on the dotted line. Just check it out.
I'd like to put a plug in also for, you've mentioned Florida Chain, of which I'm still very much a part of as a founding member, and it's been a great consumer healthcare advocacy organization into the thousands now, working closely with the Georgetown Health Institute, and specifically in the children's area, in the Children and Families Division. And as our senior partners, one of the things that we're finding is that a lot of this good enrollment with kids has come from a project called Kidswell Florida, which is part of a national foundation that has been funding 8 states. We were the last one to come on board. Why did we get funded? It was not something that we solicited. It was because of our very poor reputation on health outcomes for children, sadly, and how pitiful we were in what we were doing as far as our health care services. So, not well deserved, but that's what we got. And it's really, Gwen, it's so unfortunate that people can't listen more and be less judgmental in some of these things. And there are ways that, and I would suggest too for you listeners, with children, we've really come a long, long way in our ability to enroll them. To go to the Kidswell Florida site, because we are working closely with a lot of national partners, and have a great deal of good information for parents, working with parents and advocating for them, which goes hand in hand with the work that Dee is explaining. We've got to have the advocacy along with the administrative pieces to make this work, and the ability to be flexible. Any business goes through changes.
Oh, yes.
And you revise your plans.
Because you really don't want something that's inflexible,
But-
that can't change with the times and the needs.
And we do have some major changes coming up under the children's coverage now too, because under the Affordable Care Act, where children were funded between 100 and 150% of the federal poverty level, the children that were on Medicaid, on Healthy Kids rather, have been moved because they increased the federal poverty level from 100% for children up to 138%. Why did that happen? That happened under the Affordable Care Act because they assumed that most of the families were going to have, I'm saying to you, the Medicaid expansion for all parents. That didn't go. It was a state choice. However, the one thing that did remain is that they would raise that for children. So the children are now moving into, off of the Healthy Kids program, which is Title 21, into a Medicaid program, and much to our surprise, as they're the stair-step kids they're called, because they had different levels of eligibility, if you will. And you could have a family with 4 kids in 3 different programs, which we found, I mean, there were a lot of things that were challenging. But much to our surprise, what the data is showing is that most of those families that had a choice to stay in the Healthy Kids program and pay the premiums have now gone into the Medicaid coverage under the up to 138%. All of that is a demonstration of how things are morphing and changing and churning through this process. It's going to take some time.
And then speaking of the Medicaid expansion.
Yes, that's the elephant in the room.
As Linda mentioned,
I'm sorry.
Florida certainly has its share of challenges, and your listeners may recall from the previous time we were on the program that Florida had the option of expanding the Medicaid program, with the federal government making $51 billion, as in B, billion dollars available over a 10-year period for Florida to do so, with the federal government picking up 100% of the cost for the first 3 years.
And we're going to stress here too that Florida contributes an awful lot of money to the federal government, and I know I've been a part of social organizations for years and years and years, and we've continually tried to get some of that money back that we've contributed. And this actually would be another way of our doing that. If we don't use it, someone else will. And I'm not even going there. I'm just saying we've already contributed the money to the federal government, and we deserve to get some of those dollars back, or more of those dollars back, and this would be a way of doing that.
And there's a misperception that this is going to, further increase the debt, and we're going to owe China more money.
Deficit,
And in actuality, the Affordable Care Act was paid for and noted by the Congressional Budget Office that due to rate cuts in hospital payments, reductions in hospital disproportionate share payments for treating the uninsured, because it was assumed that the uninsured would become insured.
Right.
And also with some fees on insurance and some medical devices. So the program is paid for. This isn't something that's going to
And it isn't on the backs of the elderly with their Medicare and all of that.
It
right?
is not. Medicare is preserved as it is, and actually enhanced with the no co-pays for preventive care and the prescription assistance that is getting more generous, and that donut hole will be closed for Medicare by 2020 in this program. But Florida's leaving, at least the past 2 legislative sessions, we have left this money on the table. Amounts to about $5 billion a year that we're leaving on the table. And
when we say we're leaving it on the table, that means we're not taking advantage of it, but it's going to other states.
That's correct.
It could be coming here, our money coming back to us, but because the legislature refuses to accept it, so it's going to these other states who are open their arms to receive it.
That's correct. And basically we're telling the federal government every day that we don't want $15 million that is earmarked for Florida. So
healthcare.
Every day, $15 million, we're leaving it on the table. But the legislature still has the opportunity to act. They're going back into session in March, and they can so opt to do the Medicaid expansion or a coverage expansion of some sort.
The lookalike.
HHS has allowed states to do variations on Medicaid and has approved several requests to do so. So we have room to be flexible, and it doesn't have to be Medicaid.
Right.
And if the legislature continues to be concerned about the federal government not standing by its promise to always fund at least 90% of the program, that's something that can be addressed in legislation. A plan that was before the legislature last year and the year before said if the the 90% match goes away, then Florida's program will sunset.
Well, and that sort of goes along with a pattern over the years, because as long as the state child health insurance program, our kid care in our neighborhood, that we have been a donor state. We have returned billions of dollars over the whole time of this. This is just the same pattern, which is so sad. You know, there's another element that's come in, and that is the fact that we've got children that are on the program now for CHIP, but in 2015, that funding will be gone unless Congress renews it. So there is a robust national campaign, and one that is here in Florida that you're going to see more and more of, that we do need to continue to get those monies, because we will lose over $500 million this year if we don't go ahead and begin to put that in place. So now, although the child health insurance bill says that it will go through to 2019, there's no funding.
After 2015.
So we've got, Senator Rockefeller and others that are putting in bills to be able to say we need to expand that money. This is a very difficult transitional period with the opening of the exchanges, moving families, some of them going into the marketplace with their children, and the churning and the uncertainty of where they're going with the child health insurance program, very confusing. So for that reason, not just the monetary gain that we have, I mean, we're going to be losing a lot of money, and a lot of kids losing a good program that they've had. And I think the other thing that we're going to lose is the quality of their care.
Yeah.
After years and years of developing the program and now having a chance to augment it and make it better and get the children moved into the different programs with their parents, and you know, the expansion, our little voices for the kid care and the children's piece were running strong parallels, and our Florida chain was working closely. In fact, they were the coordinators of the grant under the League of Women Voters. They were the fiscal agent, if you will, for that. But what we found is that, and our piece would say, we find out through literature that if the parents cover, they're more likely to take their child to the doctor if they have coverage, or at least get enrolled, because many children are eligible, thousands of children are eligible for this program in Florida, but because the parent was not covered, they didn't pursue that to cover their child. So you can see where these run in tandem. It's really important for the hospitals that we work closely with them at all times. In fact, we work closely with the Florida Hospital Association as one of our strongest supporters, and forming coalitions. And that's what KidsWell was about, is our focus in the grant we had was to make sure that we carried the children, pregnant women, up through into the adulthood. So I think it sounds like a partnership.
Yes,
But
yes.
it's a heavy one, and it's got a lot of work to do.
Absolutely.
Well-
So as we look forward, in addition to all these issues and concerns, what are some important timelines and different things that will be happening, events that will be taking place as we move forward, starting with the next open enrollment period?
Well, the next open enrollment period, as I mentioned, begins November 15th and ends February 15th. Another change that is coming up in 2015 is employers with more than 100 employees, 100 full-time employees, are going to be required to provide health insurance that is both affordable and has the essential benefits that are spelled out in the Affordable Care Act. And failure to do that for at least 70% of their employees could result in fines of $2,000 per employee if they have even one employee who goes to the exchange and is eligible for a subsidy. It isn't until 2016 that those employers with 50 to 99 employees will be required to do so as well. There are some exemptions to the penalties for employers with 100 or more employees that don't meet the requirements of the percentage coverage and the affordable and essential benefits. After the first 80 employees, that fine will go in place. In the following year, that fine goes into effect for any employee over 30 employees. So those are some of the
Mhm.
things that are coming up that are going to have significant impact on employers, and I'm sure that as we go forward and that is implemented, that as Linda mentioned earlier, there will be needs to go back and tweak how this is
Mhm.
all being,
Mhm.
how this is all being managed, because it gets quite complicated when you get down into the nitty-gritty of what is
Right.
required of employers.
And this is the part of it that actually was delayed too, right?
That's correct.
And the president, his administration, listening to employers who complained, who felt that they really weren't ready, they really couldn't deal with it, it was too soon. So they delayed it, not because they didn't feel, it would work or they had everything worked out, but the employers themselves wanted to have a delay. And the president listened to their issues, their concerns, and delayed it. Of course, I think that's one of the issues they're talking about suing the president on because of that delay. Because by law, they said it should have taken place, and he, trying to help out the employers, decided, that unilaterally that he would, change it and delay it.
I have one other date to throw in there as listening to as eloquently to Dee's comments. Right now, we're also working on another thing that didn't happen. The essential health benefits did not get defined by the state of Florida. So we have a coalition together. We met with the Office of the Commissioner on Insurance, and hopefully forming a work group with him, because Florida did not define rehabilitative services, which are so essential for children and people with disabilities, to maintain and ameliorate their conditions.
Mhm.
So that was supposed to have happened, but we're now working on getting legislation passed in 2015 that would accommodate some of these, because other than some minor dental things, children are not really well addressed in the essential health benefits. Because we didn't define it by the
Mhm.
state, and so the
Because
insurance industry.
Florida did not
Well, no, we did not,
define,
and
yeah.
I think it was really more like there were so many things happening that it just didn't get on the radar of the advocacy groups until a little bit too late. So
Mhm.
once that deadline was passed, now we've regrouped for about a year, working with the disability community and the disease people, so that, because they're the ones that are really gonna have to step up and work on
Mhm.
this. So hopefully 2015, we'll see that we've amended that, and that's the other date that I'd like to throw in there.
And
And then our kids that are needing to extend the chip.
Mhm.
Don't forget chip. That's
Right,
something.
right. And I continually say on my radio show, thank God for advocates. Thank God for people who are in there plugging away, fighting for the rights of individuals who, a lot of them care, but they just don't know. There's some who know who don't care, and then there are those who just aren't doing a darn thing. So thank God for the advocates. Thank God for the people who are concerned. Thank God and there are legislators who are concerned,
Absolutely.
who are also, in there pushing for legislation that will help their constituents as well as help people overall. So we won't put them all in a bag saying they just don't give a dang, but there are people who are plugging away. People who even tried to come up with a way to utilize the Medicare dollars and expansion.
Exactly.
And of course, they didn't get the full support. But there are people who are trying to do those things that will help Floridians be as healthy as they can be, because I always say a healthy family leads to a healthy community, which leads to a healthy county and a healthy state. And then the states being healthy lead to a healthy country.
And one thing I would add is all of this is done through building collaboratives and coalitions. And everything that we have done in the world of advocacy, we're really doing in lockstep with an awful lot of the administration people. It takes a whole community to do
Working
this.
together.
Working to do that and listening and making compromises and getting to consensus, which is difficult to do. And that's where we're so glad we do with the Florida Hospital Association, Florida Pediatric Society. We spend a great deal of time with them. And it's building those relationships and building trust, which is probably the most difficult thing to do. You have to listen and be willing to give in to some things and get to the point where you're accomplishing your mutual goals. Not an easy task,
I can, time for station identification. You're listening to Truth with Gwen Azama-Edwards. This is WLE-BIG 1380 AM on your radio dial in Ormond Beach, Florida. And I'm here with two great, wonderful friends who are knowledgeable. They are, you know, I hate to use the term experts because people like to, you know, kind of say stuff about that, but they are truly, truly some of the most knowledgeable, two of the most knowledgeable people you'd ever run across in terms of healthcare issues. Linda Merrell, who is a child advocate, who is associated with Florida Chain and some other groups as well, consultants. And we have Dee Schaeffer, who is with Halifax Health. And we're talking about the Affordable Care Act, and we're talking about those things that are coming up, those things that have already occurred, the pluses that you are finding and receiving as a result of the Affordable Care Act, the Patient Protection Affordable Care Act. Benefits that every single American is receiving as a result of that act. And whether people acknowledge it or not, it's there and it's helping everybody. And it's overall helping this country be the healthiest that it can be, at least moving closer to that point, which is so key and so important. See, that air conditioner is, I do apologize for that. But, you know, as we've gone through a season of summer with the heat and the like, with people dealing with that, and now we're dealing with the rain and all of the stuff that happens with that. There's Ebola, you know, in other countries. That's a concern for us as well. If anybody with it brings it over into this country, I mean, there are so many important health issues that are also tied, if we think about it, with the Affordable Care Act, because it's also about training health professionals, right? And providing things like to work with mental illness and addictions and the like. I mean, these are things that touch every family.
That is correct. Mental health, well, behavioral health was put on parity with other benefits in the Affordable Care Act.
Which we in this state have been pushing for and fighting for longer than I can remember.
Exactly.
Yes.
And, well, you and I go back 25 years.
Oh, yes.
I was gonna say, I think that's what I meant you.
advocating for that. But-
Well, the just say no, and some of that stuff going way back, I'm telling you.
Yeah,
Comes around.
but the, you know, the increasing the availability of primary care providers as well as surgeons.
Mhm.
Halifax was fortunate enough, actually Senator Bill Nelson had a provision put in the Affordable Care Act that required any physician residency program slots that were not used for a certain period of time to be reallocated. And hospitals, teaching hospitals had the opportunity to apply for some of those slots. And Halifax did, and we were awarded 10 surgical residency slots.
Awesome.
So
That's
we have
great.
been building
Yeah.
that program up for 4 years now, and we'll reach our 10 cap next year. But that's something that probably 75 to 80% of physicians who train in a community stay in that community. That's certainly true of
That was the point I was
Halifax's
gonna make, yeah.
family practice program. You know, those docs stay in this
Yeah.
general area. So while when we did our physician review a few years ago and said, oh, our surgeon workforce is getting ready to retire or going part-time, we really need to start focusing on this. So we are virtually growing our own. So that is another benefit.
Right,
And
I
I-
thank you, Dee, for a lot of that good work. I mean, that she
Yeah.
really did a hard job. with
Yeah,
that, and
yeah.
We've got a couple of other things going on. but-
And I should have asked you this before. Usually I don't hit somebody with something, you know, while they're here watching video and all this kind of stuff. But the medical community, and I know they have mixed reviews in terms of the Affordable Care Act and the like. But are more of them, because I know with Halifax, as with other hospitals as well, that you have doctors that are some of the best ever. Individuals who will many times extend themselves beyond, above and beyond, just like with the lady from outside of the country that one of them operated on to remove a tumor that she'd had for years. I mean, just taking on people that would not many times be accepted in hospitals, other hospitals, but they your physicians have taken that on. But I hear from individuals, you know, from time to time who say, oh, the doctors are so totally against this. I got some that are dropping this and closing their doors and this, that, and the other. And, you know,
that's interesting. It's
yeah.
That's a hard one to tackle, and for sure. But you know, there are some things that have happened that are helping them, and that is the increase in their fees that has passed. It's a small thing, but it's a big thing. I worked very closely with the Pediatric Society and the American Academy of Pediatricians, and they did see a slight increase finally, which should have been placed months ago. But those efforts are improving, and also something called the sustained growth rate. For years, these physicians have not been able to be compensated for the growth in their costs as they need to take care of patients. So it seems every year we're out there fighting for that, and Congress passes a temporary package to fix it. But maybe one day we're going to get to that point. But the other thing because of the affiliation with medicine, the Affordable Care Act and the American Medical Association, we're right along with going to electronic records, and Dee might just chime into that. Well, and that's the debate I get a lot when talking to physicians that are very dear friends, and I can see why. That was an amazingly difficult, cumbersome, costly. The amount of money that was provided in the Affordable Care Act did not cover what it took for them to go to electronic records. All that being said and done, apparently that is beginning to evolve from what I hear a little bit better, but the AMA is saying they need to have some relief in how long it's taking them to process even after they do that. And they are appealing, I think, to HHS now to try to find something to make it less intrusive for the physician. They're on board, electronic records are going on, and I think that, I don't know whether you've run into that or not, but just recently, I think last week was when we saw that, that's going to be the next thing we need to have done.
Yes, I have. It is quite a transition for particularly individual practices and small practices, because requirements for reporting, just like hospitals, for reporting certain outcomes, particularly for Medicare patients, is going to happen with physicians in the coming year or 2 year. I can't remember if it was 2015 or 2016, but just like hospitals who are having their Medicare payments reduced if their readmissions are over a certain percentage, or if there are hospital-acquired infections. It's basically things that are measured on a quality basis. So the hospital payments they're being reduced this year, and physicians are yet to come, but it does involve more reporting, and then ultimately they will be expected to report some type of quality indicators that I believe are yet to be developed. So there are those concerns, and exactly as Linda said.
And I can say, as a patient who watches her doctor, you know, put in the information and the like, and even though it consumes a little bit of time, I personally appreciate the fact that there is something going in that, you know, if I go to another doctor, all he has to do is look at my record, and he can see what I've had, what's been prescribed, what I've been dealing with, and I don't have to try to, you know, to cough up all that information that I don't know, you know, hey, I'm dealing with something, my mind can't even think about that. Can't you just look somewhere and see? And my doctor, my personal doctor, Dr. Cucciarella, a couple of years or so back, actually started, you know, having me fill out some information that they could key in, and now when I visit him, he just adds to it, his nurse adds to it, and it's truly awesome. It is just truly awesome, and personally, long overdue. I know I'm sure it's time consuming and all that good stuff, and I appreciate what, you know, the doctors are feeling and the like, but I would tell you as a patient, just long overdue.
Well, from a hospital perspective, you know, the electronic medical record and what you are able to just get printed out, you know, the thought is that it's going to reduce costs over the long run.
Absolutely.
There is
And
the initial-
usually it takes a long, long run to get to there, but.
But that is part of the thought, that it should reduce cost, it should increase quality and reduce medical errors, particularly in the arena of writing prescriptions.
Yeah.
Because when I was last at my doctor, I left with a printed out prescription that had already been called into
Yeah.
or already faxed to, or however they do it, to the pharmacy.
Right.
And very legible, as opposed to some prescriptions I have received in the past. So
And I'm also able to go and get a copy of what the result was.
Exactly.
You know, to see, because sometimes doctors aren't that forthcoming. They won't give it to you until your doctor's gotten with you, but, you know, you can see for yourself just what, because sometimes when they tell you, you know, your mind isn't quite there.
Right.
Seeing it in black and white just makes a little
Yeah.
more sense, you know?
Well, I have to give a plug here for Florida Healthcare, who, my husband is insured by. Halifax
Me too.
is
Awesome,
self-insured,
awesome.
but they have done an exceptional job of implementing the electronic medical record, and they even have a service where you can go in and log on with your individual information on
Mhm.
a very secure
That's great.
site. And my husband can actually go on and pull up
Yes.
past lab reports.
Absolutely.
And the last physician
And there's a mobile,
notes.
that you can
Yes,
use and get into.
It's incredible.
Yeah,
And-
we're in the 21st century, you know?
But it is going in the right direction.
Yes, it is.
So
Yes, it is.
progress sometimes is painful.
It needs to be flexible and
Yeah.
understanding.
And the Affordable Care Act is what pushed us to it. It really
It's the
is,
driving
you
engine
know,
for all this
yeah.
stuff.
And sometimes, you know, we know that things are important and we keep saying, you know, we'll get to it. And there's always something that keeps you from getting to it. And sometimes you need something like this that will kind of propel you into it, to the point where, you know, maybe, you know, you kind of drag a little bit along, but you get it done because it is important. It truly is important. And my hope is that as time goes on, as more things come on board, and as we deal with some of these issues that, you know, are flushing themselves out, hopefully, that we will see more and more of what's important for healthcare put into place.
A big picture that I think we don't pay attention to, and being a fan of the New York Times, I kind of watch these things, but we're bending the curve of the cost of healthcare in
Yes.
this country.
That's
Just as it
correct.
was protected, you gotta look at the big universe, and all of these little things that are down here are happening and are being adjusted, but that curve is coming down, and for many of the good reasons that we've just talked about.
Yeah. And
that
that was
to me is an indication of there's a hope.
Absolutely, because that truly was the driving
Yeah,
force. I mean, we were at a point of the
Long
healthcare
distance.
costs double digit every year. It wasn't sustainable.
The worst
And it was impacting the economy of this country, because those dollars that could have been spent elsewhere, spending toward other businesses to help them stay in place, you know, and be productive, et cetera, were going toward healthcare. I mean, a large percentage of the dollars that could have been better used and utilized and helping the economy elsewhere was going toward healthcare. And now we're seeing some of that, you know, some of that curbed somewhat. And, you know, I said that at a meeting, and I had someone say, well, now it's going back up. I said, you know, the problem with that, you guys aren't a part of this, but I'm gonna say this, the part of that is that greedy people can always find a way, you know, they can always find a way to try to stay greedy. And we have to make sure that we try to work to make the system work better, such that greed isn't a common denominator for decisions that are made and what's done.
Well, since you mentioned economic indicators, I wanted to just make a couple more comments about Medicaid expansion and its value, or coverage expansion, because it isn't, you know, it isn't just providing an essential service to some of our lowest income Floridians. I mean, the 138% of the poverty level is the break off for who would be eligible here. For one person, it's about $16,000 a year. For four, it's about $33,000. So these folks aren't making a great deal of money, but.
And that's about our median income for this county, isn't it?
But, well, in this county, in the two-county area, it's roughly about 40,000 people we estimate would be eligible for a coverage expansion. And on top of that, the University of Florida did an economic impact study of what this would mean if we did do that expansion. It would be somewhere between 850 and 1 million people statewide,
Wow.
50,000 to 1 million. But the interesting aspect about the University of Florida study was that they estimate that this will create at least 120,000 jobs across multiple sectors,
Wow.
of which 3,500 would come to our Volusia-Flagler area. So not
Excellent.
only is it the humane thing to do,
Mhm.
but it also does have tremendous potential economic benefit.
Yes, yes, absolutely. And one of the things that when I went to Tallahassee with League of Women Voters and others to try to get our legislators on board with the expansion, and what I continually said was, we're talking about, for a lot of that, the working poor.
Yeah.
These
Well,
are
that's
not
right.
people that are not working. They are working, but they're just barely making it,
That's
barely
right.
surviving.
And some of them with 2 or 3 jobs.
Yes, absolutely, and that's so true in our area, as is true, I'm sure, of a lot of other areas as well. So we're not talking about people who just not working, they won't go and try to get a job or whatever, like they like to kind of put everybody in that basket, but we're talking about people who are truly just barely surviving, who are working and who need that extra help so that those dollars can be spent in other areas to help their families.
And to be cautious about this, when you look at some of the Medicaid alternative plans that would be offered, you want to be very, very aware of the fact that these folks are not going to be able to afford premiums that are being
Correct.
added or co-payments that would not be acceptable. I understand that somebody that have the dollar can pay because then they really be able to use the services, but I would hope that we are on the side of being careful that they're not gonna be able to afford that
Yes.
and then don't get the care. So that's
Exactly.
gonna be one of the things that we'll be watching closely this year,
Mhm.
if they come out with yet another kind of alternative.
To the
plan.
expansion,
Yes.
alternative to the Medicaid
Right.
expansion,
We
yes.
need to look at that.
Mhm.
But the other element is that, Florida spends on an annual basis about $450 million on a program called Medically Needy.
Yes, that's
And
right.
this is for people who have a catastrophic life event, that the medical bills actually bring them down into Medicaid eligibility levels. And if they did do a Medicaid or a coverage expansion, those individuals could all be moved over into that program, with the federal government, at least this year,
Mhm.
paying 100% of the costs and saving Florida $450 million that they could allocate elsewhere.
Yes,
That
yes.
doesn't get enough visibility. That is something, medically needy has been something that we've worked in with the development of disability community for years. And that
Mhm.
is, to me, the diamond in the rough, that if that can happen, that is going to really be, we need to promote that more and more, those of us that are in the field.
Time, as usual, has run out, so I'm gonna give you ladies an opportunity to share, anything that we've not, I know there's so much to this, so much that needs to be said, needs to be covered, but, give you some closing comment time here as we close this segment of the Truth Radio Show.
Well, I'm gonna start with the children's piece first, and that is, if I had one thing that we need to leave here with, is knowing that everybody, Republicans, Democrats, Independents, need to be supportive of expanding the CHIP program, the program for children, past 2015. And if we don't, not only will we lose those funds that I just mentioned, but over 400,000 children would be dropped from their current coverage. So that is something that we need to concentrate on, if we have one thing to emphasize right now.
And I would just say that, as Gwen, you have said, everyone who has health insurance across America is benefiting from the provisions in the Affordable Care Act. And I would hope that, that as we go forward, repeal philosophy could be
Yeah.
set aside and just work on fixing those things that we know need to be fixed. But it's been tremendously valuable for many, many families. I can't tell you right off the top of my head how many kids under 26 benefited
we've
from this,
done,
but it's,
yeah.
it's hundreds of thousands
Mhm.
across the country, and people who are no longer denied health care coverage because they have a pre-existing medical condition. The annual and the lifetime caps. Those are all very big things, not denying coverage, because somebody made an application error, and when they go to get care, their care is denied.
Right,
So there are
right.
so many things, but I would hope that as we go forward, and I know Linda and I will both be working up in Tallahassee to, again, continue to try and urge our legislature to do a coverage expansion.
As will the League of Women Voters and anybody and everybody who cares about affordable health care for not just the Florida citizens, but around this nation, because it's so key and so important. I will repeat what I said before. A healthy, healthy parents and leads to a healthy family, which leads to a healthy community, which leads to a healthy state and a healthy nation. And that should be key and important to all of us, because the healthier people are, the more productive they are, and the less in terms of all the negatives that we read about, all over the world. They've got, they would have care available for those who have some type of mental illness or a mental impairment, individuals who have other types of physical impairments and the like as well. Young, old, all are benefiting from the Affordable Care Act, the Patient Protection Affordable Care Act, and it's something that needs to be continued, something that everybody, again, is benefiting from in a very, very positive vein, and it is working. It is working, and it's going to get even better. So let's just stay the course, and as Linda has said, doesn't matter if you're what party you are. This is a nonpartisan issue. Healthcare is a personal and a people issue, and all of us who care about each other should care about ensuring that all people are healthy. So we're going to leave you with that, and my thanks to my very, very good friends, Dee Schaeffer and Linda Merrell, and all the information that they have shared. And we will have this on YouTube, and we'll have it everywhere possible, so you guys can key in and understand that open enrollment will start again November 15th for those who are interested in looking again at their enrollment or getting enrolled. And do check it out. Again, that site is Enroll America. They should go there. They should check that out, and you can check it out without making any commitment. Find out for yourself. Don't depend on what other people are telling you. Even us. Find out, check it out for yourself. Okay, you've been listening to Truth with Gwen Azama-Edwards. Again, my guests Dee Schaeffer and Linda Merrell. And be sure to listen every Thursday, starting about, we're going to say about 6:30. As we discuss issues to inform and empower your listeners, go to the website as well, www.gwen-truth.com. Until next time, be informed, be empowered, stand tall for that which is right and truthful. Again, Happy New Year, the Jewish holiday. We do thank everyone for joining in on that. And again, this is Truth with Gwen Azama-Edwards, and like my friends Dee and Linda and myself, and hopefully you too, we're still standing. You be blessed and have a great week.
Truth with your host, Gwen Azama-Edwards, exclusively every Thursday night on WLE 1380 Radio,
Awesome.
Ormond
I
Beach,
do
Florida.
appreciate you so very, very, very much.
You do a great job. Good evening. It was terrific. Really, you did it well.
Very good.
You taught me stuff.